Hello everyone. So today I have come with another topic of pharmacology from the antimicrobial agent, that is macrolide. So what is a macrolide? Macrolide जैसे कि नाम से पता लगता है, macro means a large. So there is a large cyclic lactone ring in their structure. That's why it is named so. And along with that, it is attached with the sugar. Like the first member of this group is erythromycin. There's a 14-member lactone ring with 2-deoxy sugar. So it consists of the natural as well as a semi-synthetic. So you can see natural में आपके दो आते हैं, erythromycin and spiramycin, whereas semi-synthetic also called as a newer macrolide. Under this comes roxithromycin, clarithromycin, azithromycin, and telithromycin, and few more like tacrolimus. It is a immunosuppressant, but it is also a macrolide antibiotic. Then we have fidaxomicin. This is a macrolide which is approved for the treatment of Clostridium difficile infection. Now, how this group of drug they act? They act by inhibiting the bacterial protein synthesis. This is a common. Okay? So they are static as well as a cidal. So static and cidal, its action depend upon the type of the microorganism. But basically they act by inhibiting the bacterial protein synthesis. अगर आप इतना लिखते हो, it acts by inhibiting the bacterial protein synthesis. So you will be getting the act by inhibiting the bacterial protein synthesis. So you'll be getting the passing marks. But which step of the bacterial protein synthesis? Because some multiple steps they are involved in the bacterial protein synthesis. So you have to specify this group of the drug, it is going to act exactly where. So prokaryotic cell, their translation that is initiated by the formation of the initiation complex, which consists of 30S ribosomal unit, this one. Then we have a transfer RNA and messenger RNA, means all the RNA they are involved. Ribosomal RNA, the 30S subunits, then transfer RNA and ribosomal RNA. So transfer RNA mainly it is with the amino acid formyl methionine. This is the amino acid that is attached. Now with this, the 50S ribosome that is also going to come and join this one. This whole complex, the 50S ribosome subunits, that is also going to join, and this makes it 70S. So this 70S ribosome, it has got two important sites. One is A site, which is called as acceptor site. Another one is a P site, that is a peptidyl site, and one more, that is a E site, or we say exit site. What happened? The transfer RNA, which is carrying this amino acid formyl methionine, it is going to bind with the peptidyl site, and you can see this transfer RNA, there is an anticodon, and on the surface of this messenger RNA, the various codon you can see. Now, what happened? The next transfer RNA is going to bring the amino acid, which will be attached to this acceptor site. You can see here. So amino acid, transfer RNA carrying this proline amino acid, and which amino acid it has to deliver here, it depends on the codon which is there on the messenger RNA, because this codon it is complementary with the anticodon which is carried on the transfer RNA. Now this amino acid it is delivered on the acceptor side. Now what happened? The amino acid which is there on the peptidyl side, it will be transferred from the peptidyl side to the acceptor site, and there is a new peptide bond formation will be there. ये आपका यहाँ पे peptide bond is formed between the newly attached, this proline, it is a newly attached amino acid, and formamyl methionine, this is a the previous amino acid. So this peptide bond formation, this is there. Now what happens next? Now this whole subunit, it is going to this ribosomes, it is going to move. How much it is going to shift to the next codon? यहाँ तक था, it is going to shift to the next codon, that is this. So by the time it is going to shift to the next codon, जब ये पूरा का पूरा ये आगे जब shift करेगा, when it is going to shift further, then what will happen? This whole thing, this whatever is there on the acceptor side, ये जो यहाँ पे acceptor side है, this will be shifted to where? On the peptidyl side. And this transfer RNA, it will be released where? On the exit side. Just see the next diagram. So you can see this is the exit, and the whole thing is shifted from the acceptor to the peptidyl side. Now acceptor side, it is again ready to accept the next amino acid or next transfer RNA which is carrying the amino acid. On the next codon, that is, you can see the next codon. So next transfer RNA will be coming and joining this acceptor site, and the amino acid, which amino acid will be delivered? Where the anticodon will be complementary to this codon which is there on the messenger RNA. And the same process will be again repeated. Suppose यहाँ पे आपका एक नया amino acid, if that is attached here, then what will happen? The whole thing from here, it is going to move to this, and the process, it continues. ये चलता रहता है, whole this thing. Now again this ribosome, it is going to shift to, कितना shift करेगा? Shift to a distance of 1 codon, and again amino acid will be transferred with the help of the transfer RNA, and this process keeps on happening, and this till the exposure of, कब तक ये चलेगा? Till the exposure of stop codon, like you can say UAE. Once this is the exposure of stop codon, then what will happen? Now this ribosomal subunits, they get separated, 30S, 50S अलग हो जाएंगे, and this polypeptide chain, long polypeptide chain, this is also separated from the transfer RNA. So what happens? What the macrolide, what they do, they inhibit this translocation. ये जो translocation है ना, from here, from this after the peptide bond formation, यहाँ पे. So translocation of this one, I'll use another color. So translocation of this after the peptide bond formation, translocation of this whole thing, amino acid, from the acceptor to the peptide, this is blocked by the macrolides. So this is how the protein synthesis, that is inhibited. Once this is not done, then what will happen? The ribosomes, it will not move further on the messenger RNA. So there will be no exposure of next codon, and what will happen? So this way the protein synthesis, that will be inhibited. So for the mechanism of action, first you have to write, because it is going to act by inhibiting the protein synthesis, so it has to enter within the cell. So it enters within the cell or intracellularly by the active transport. Number one, this. Number two, it is going to bind with the 30S ribosome. Then third is, it is going to inhibit the bacterial protein synthesis by inhibiting this translocation of this change. Then you can explain it with the help of diagram or with the help of text. So you can see here how to write it. Macrolide, the first I have told already, intracellularly binds with this, then it is going to inhibit the bacterial protein synthesis. What step? Now after the peptide bond formation between the newly attached amino acid and the nascent peptide chain at the acceptor site, now the elongated peptide chain, it is translocated back to the peptidyl site, making this A site or acceptor site available, so that the next amino acid transfer RNA get attached to this. Now this translocation, it is blocked by macrolide. Now the ribosome, it fails to move along the messenger RNA to expose the next codon. So peptide chain, that is terminated and synthesis of the protein that is suppressed. Now resistance can develop because it has to enter within the cell, आपका ये cell के अंदर, so efflux can happen. Number one. Number two, it has to bind with the 50S ribosome. If there is any change in the ribosomal binding site altered, then that also leads to the resistance. Now next one is the antimicrobial spectrum. This is where the students usually they find the problem how to memorize this antimicrobial spectrum, because most of the book what they write, I will show you next diagram. In most of the book you will be erythromycin antibacterial spectrum. It is highly active against gram positive negative cocci, streptococcus pyogenes, pneumonia, Neisseria gonorrhea, moraxella, then gram positive bacilli, then gram negative bacilli like Campylobacter, Legionella, Brenhemella, Gardnerella, vaginalis, spirochetes and Mycoplasma, and moderately sensitive against. So ऐसे दिया होता है highly active and moderately sensitive or mild active or no activity, that is seen in most of the antimicrobial agent the same way. So it is easy to read, but the easier you read and the more easy to forget it. So what is the best way to memorize? Because in the exam, usually if you get a short note on any antimicrobial agent, then you are supposed to write the antibacterial spectrum. Otherwise, in most of the cases in MBBS, we ask classification of this antimicrobial agent like fluoroquinolones, right, its therapeutic uses and adverse effect. So if you know it, this particular antimicrobial agent, it is effective against which microorganism, so we can think of this is effective against this. Like here, if I say it is effective against streptococci, that means it is effective against the upper respiratory tract, like किसी को pharyngitis है, tonsillitis है, it is a causative microorganism for that. ठीक है, तो इस like legionella pneumonia यहाँ पे ये effective है. So but the easy way how to memorize, because once you read one antimicrobial agent, it is easy to remember. But if you have to read many, then you get confused. So how to remember it? This is a one way of memorizing it, easiest way of memorizing it. So in a piece of paper, you can write all the microorganisms starting with the कोकाई, जैसे ये आपने कोकाई का लिखा, ग्राम पॉजिटिव कोकाई, स्टेफाइलो स्ट्रेप्टो निमोकोकाई, देन ग्राम नेगेटिव कोकाई आप नेज़ेरिया, मेनिंजाइटिस, गोनोरिया, ब्रैनहेमेला, बैसिलाई आप लिखना शुरू कर दो, कॉर्निबैक्टीरिया, बैसिलस, क्लोस्ट्रिडियम, उसके बाद नेगेटिव बैसिलाई लिखो आप, फिर उसके बाद आप ये सारे माइकोबैक्टीरिया और सारे मिसलेनियस. So for this, your microbiology should be, especially bacteriology part should be very good. तो आप इसको you write it on one piece of paper and get it photocopy करवा लो, 8-10 pages उसके करवा लो. Now what is the next thing you have to do? Suppose here I have written all this, उसके बाद you see it is effective against which microorganism? Highly active. So you can use either 3 cross for the highly, 2 for the moderately and 1 cross for the mild. और जहाँ पे कोई activity नहीं, it does not show any activity, you just leave that place like blank, और वहाँ पे कुछ negative वगैरह, don't write anything like that. So here what I have done, you can see the cross with the 2 color. आपको 2 color दिखेंगे, एक आपको ये blue color वाला दिखता है and another one is you can see the red. So blue and red color. So this drug, it is effective against all these microorganisms. So red color shows it is effective. Erythromycin is effective against, highly active against this microorganism, and blue color shows the penicillin, that is the main drug against this microorganism, because erythromycin, it is effective against gram positive microorganism. Penicillin, that is also effective against the gram positive microorganism. So antimicrobial spectrum of penicillin and erythromycin or macrolide group of the drug, there is a overlapping. लेकिन ये है कि positive blue वाले में क्या है, the penicillin, it shows more activity, but if the person shows hypersensitivity, because with the penicillin one of the most important adverse effect is hypersensitivity reaction. So if the person is allergic with the penicillin, or yeah, जहाँ पे कोई any other reason, because of any other reason, the patient cannot take the penicillin. So there, instead of the penicillin, we can use the erythromycin. So erythromycin, it is used as an alternative to the penicillin. So यहाँ पे आपने, like if you want to write the therapeutic uses of the erythromycin, so you just write all that, just check it once कि हाँ हमारे पास कौन कौन से हैं, what all the positive. Here red color के आप note कर लो 1. So this is a 1 thing, 1, ये हो गया आपका 2, 3, 4, एंड देन ग्रीन कलर वाले ये सारे ले लो हेयर, ठीक है, ये वाले ले लो, एंड देन यू कैन राइट द थेरापेटिक यूजेस ऑफ दिस. लाइक अगर मैं यहाँ पे लेती हूँ, आई हैव पिक्ड अप फर्स्ट वन दिस एटिपिकल, सो एरिथ्रोमाइसिन, ये वाला यहाँ पे नंबर 2, इट इज नॉट अफेक्टेड बाय द पेनिसिलिन but highly sensitive to, ये मैंने लिखा कि this sign indicates what, it is not affected with the penicillin but highly sensitive to the erythromycin. like माइकोप्लाज्मा निमोनिया हो गया, देन यहाँ पे आपका लीजियोनेला लीजियोनियोज निमोनिया, but again I have written from the same group are azithromycin that are preferred, then from fluoroquinolone ciprofloxacin they are preferred, then campylobacter, this causes a campylobacter enteritis GIT infection, again fluoroquinolones they are preferred over the macrolides. So ये इतना हो गया. Then coming to this one, hemophilus influenza and Ducride it causes the chancroid, तो वहाँ पे है. Then again bordetella it is going to cause a whooping cough, so pertussis it is effective against that. So chlamydia, then again another important is chlamydia and rixia, यहाँ पे भी it is showing a effect. तो chlamydia लिखा मैंने, chlamydia trachomatis, chlamydia it is going to cause a non-specific urethritis and genital infection. Then another one is therapeutic use. This is with the diabetic gastroparesis, because erythromycin it is going to stimulate the motilin receptor which are present on the gut, and once it is going to stimulate the motilin receptor, what it is going to do, it is going to increase the lower esophageal sphincter tone. ठीक है, उसके बाद gastric emptying it is going to enhance, then it is going to cause the contraction of the GIT throughout the GIT except the colon. So ultimately what it is going to, it acts as a prokinetic agent. तो जहाँ पे diabetic gastroparesis है, so there we can use it. If you want to see a detailed video on the prokinetic drug, you can watch it. I will be giving a link in the description box. So this is how you are supposed to write the therapeutic uses of erythromycin. Now on the top, if you will be seeing this one, positive streptostaphilo. So here what is this is used for the, इसमें क्या है, the first line which you are not able to see here I have written. So here the erythromycin it is used as an alternative to the penicillin यहाँ पे. So कहाँ पे करना, streptococcal pharyngitis, आप यहाँ पे कर दो streptococcal pharyngitis, tonsillitis, mastocytitis, community cap में हो गया community acquired pneumonia, respiratory infection due to pneumococci and H influenza. Then prophylaxis of rheumatic fever and SABE, that is subacute bacterial endocarditis, in patients who are allergic to the penicillin. Then third one is a gonorrhea and syphilis. Then यहाँ पे आप फिर से देख सकते हो Clostridium tetani, वहाँ पे Cornybacteria diphtheria, ये Cornybacteria diphtheria Clostridium, तो आप ये सारे, so you can write all that. Gonorrhea here also penicillin that is effective. So this way you can write its therapeutic uses depending on the antimicrobial spectrum. So newer macrolides. Now the newer macrolide we have a roxithromycin, clarithromycin, azithromycin and telithromycin. Now why we need a newer macrolide? That means some shortcomings they are seen with the erythromycin. सबसे important उसमें है, it is a narrow spectrum in comparison to these. ठीक है, इसमें क्या है, erythromycin वाले तो आते हैं plus some additional, they are going to cover some additional microorganism. So another important is, so narrow spectrum होगा, gastric intolerance, so they are GIT side effect इसमें आते. Then gastric acid lability, so they are the acid labile, acid stable नहीं है. So entry coated erythromycin they are used. Bioavailability that is low, and tissue penetration that is less, and half life it is short, so we have to give it as a 4 times a day, QID, 4 times a day इसको हमें देना पड़ता है. So these are the limitation of the erythromycin. That's why we use nowadays semi-synthetic macrolides. So you can see in this slide, especially the half-life which I have, and acid labile. This is acid labile है, ये ज़्यादा increase, and all these they are the, ये ज़्यादा नहीं है, sorry, bioavailability. F stands for the bioavailability. You can see it is less with the erythromycin, more with the roxithro, clarithro and azithromycin. Why it is less? Because they are the acid labile. Then you can see the half-life. इतनी कम है, 4 times a day. This is 12 hours. Roxithromycin we give twice a day, twice daily dosing. Clarithromycin 6 to 9 again twice daily. And whereas azithromycin it has got the longest half-life, so we are using it once a day. Now coming to the next one, roxithromycin, how you can remember the this one antibacterial spectrum of the rest of the macrolides. So here few you cannot is not visible. So first column is of ये वाला जो आपका column है ये पहले हो गया. This is for the erythromycin. I'll write here. ये आपका हो गया. This I have completed. And now the second one is this is a roxithromycin. So इसमें आपने कैसे how you are supposed to write? So usually what happens, you will be reading one thing, so microbial spectrum of rest of the, they are almost same, just like erythromycin. क्योंकि I have told they are narrow spectrum, तो बाकी के जो हैं they are going to cover more number of microorganisms. So one thing is, so their antimicrobial spectrum is same as the erythromycin. Or what is differentiating? You have to mention that. Like here, Brand-Hemella cataralis, it is more potent as compared to the erythromycin against this. More potent against the Bordetella. ठीक है, more potent against the Legionella. So anti इसमें आप क्या antimicrobial spectrum of the roxithromycin, it is same. So it is showing more potency. इसमें the better is इसमें, and even we can give instead of erythromycin we can use roxithromycin because it has got the long half life and we have to give twice a day. तो जहाँ पे आपने erythromycin use करनी, you can use this also because of the twice a day. So patient compliance, it is better. So you can see in the next slide, it is a semi-synthetic, long-acting, stable macrolide with the same spectrum, more potent against Brand-Hemella, Gardnerella, Legionella, but sorry, less potent against the Bordetella pertussis. So इसमें advantages क्या हैं? BD and better gastric tolerability. So we can use it as an alternative to erythromycin in most of the places with a similar efficacy. Now coming to the next one, clarithromycin. Clarithromycin में whatever is here, you can see LORI. LORI is here is H. pylori. क्योंकि यहाँ पे इस line में I could not write H. pylori. So it is effective even against H. pylori. फिर ये वाला portion which was missing, यहाँ पे देखो कहीं पे भी नहीं है. You cannot see, यहाँ पे कुछ नहीं है, but you can see later on with the clarithro and azithromycin. So you can very well visualize. So यहाँ पे कौन से mycobacterium. So this roxithro and azithromycin, they are showing activity against the mycobacterium. Like अगर मैं clarithromycin का हूँ, so clarithromycin it is showing activity against the mycobacterial lepra. इसमें है आपका mycobacterial lepra, ये वाली एक. Then atypical mycobacterium and MAC, mycobacterium avium complex. And where else it is used for the, in comparison to these two, first one the mycoplasma pneumonia, वहाँ पे effective है. Then Legionella maybe it is more effective. Then H. pylori मैंने बताया. Then Brand-Hemella and Moraxella, one and same thing. They are the causative microorganism for the lower respiratory tract infection. So वहाँ पे. So if now you know the this one, so इसमें भी we can write the same. जहाँ पे आपने wherever you want to use erythromycin for the upper respiratory, there you can use it. Plus a triple drug regime in the H. pylori. Then second line drug for the mycobacterium lepra, and then atypical mycobacterium. Then MAC, mycobacterium avium complex in AIDS patient. Legionella pneumonia, Legionnaires pneumonia, उसमें we can use this clarithromycin. So you see here upper and lower respiratory tract infection, same I have written here सारा जितना erythromycin का triple drug regime, first line drug for MAC, second line drug for the leprosy and atypical mycobacteria disease. अब same azithromycin में भी हाँ, it is less effective against the cocci जितने भी है, ठीक है. But यहाँ पे है Neisseria, gonorrhea, वहाँ पे it is effective. यहाँ पे you can see here MAC वाला तो दिखता ही है. Plus you can see he HI stands for Haemophilus influenza. So it is very effective against Haemophilus influenza and even the other species Haemophilus. ही यहाँ पे मैंने लिख दिए दो. So once you write it, you can rewrite it in a better way. Haemophilus में दोनों species, take out a bigger page where you can write it easily. So Haemophilus ducreyi and Haemophilus influenza, it is highly effective against these two. फिर उसके बाद आपका MAC आ जाता है. Then Callimatrobacterium granulomatous, अभी तक कोई भी नहीं थी. So this is effective even against this H. pylori. Clarithromycin, it only shows the activity against the H. pylori. Similarly, against the Callimatrobacterium granulomatous, it is only the azithromycin which is going to show the activity. Then Chlamydia trachomatis, ये यहाँ पे लिखा हुआ है. Campylobacter, उसमें भी highly active. Then Legionella. सो इसमें क्या है, लाइक थेरापेटिक यूजेस, इट इज ऑलमोस्ट 4+ मैंने लिखे, दैट मीन्स फॉर द लीजियोनियर्स निमोनिया इट इज अ ड्रग ऑफ चॉइस, अगर मैं ये बाकी सारा वहाँ पे इसमें, देन फॉर द कैम्पाइलोबैक्टर एंटराइटिस वहाँ पे है, देन क्लैमीडिया ट्रैकोमैटिस विच इज गोइंग टू कॉज द नॉन स्पेसिफिक यूरोथराइटिस एंड जेनिटल इन्फेक्शन, वहाँ पे भी मैंने इसको देना है, देन इट इज इफेक्टिव फॉर द माइकोप्लाज्मा निमोनिया, Calamobacterium granomatosis which is going to cause the donovanosis, वहाँ पे भी मैं इसको दे दूंगी, then it is effective against the Mycobacterium avium complex, वहाँ पे भी I can use that, then for the Haemophilus ducreyi it is used for the chancroid also. So these are the therapeutic uses of this azithromycin. And you can see the next slide. It is highly active against the respiratory pathogen, Mycoplasma, Chlamydia pneumonia, Legionella, Moraxella, and others like Chlamydia trachomatis, H. ducreyi, Calamobacterium granulomatis, and Campylobacter. More active than other macrolide against the H. influenza, MAG. Then penicillinase producing Staph aureus, they are inhibited but not the methicillin resistant Staph aureus. It is showing the less active against the gram positive cocci and not active against erythromycin resistant bacteria. वहाँ पे ये काम नहीं करती, and where we can use it already I have told this one. Okay. And chancroid, then of course upper respiratory, MAC, typhoid, toxoplasmosis and malaria. So this way it is easy to memorize the antibacterial spectrum. आपको यहीं से देख के पता चल जाता है कि हाँ कहाँ पे पॉजिटिव ज़्यादा है, किस में कम है. And if you have a little bit, you apply the microbiology knowledge कि this bacteria, it is a causative microorganism of what, it is very easy for you to write the therapeutic uses. I'll show you another one, like this is for the fluoroquinolones. You can see ciprofloxacin, norfloxacin, ofloxacin. If you make one for this, so you can see here this portion, ये वाला, ये middle portion, ठीक है. This is in this is the one which is showing कि हाँ most of the fluoroquinolones they are active against this E. coli, Klebsiella, gram negative bacilli में ये ज़्यादा है. Whereas if you see here, यहाँ पे देखो ग्राम नेगेटिव के लिए नहीं है. सो दिस erythromycin they mainly show the activity against the gram positive microorganism, whereas ciprofloxacin they shows the activity against the gram negative. So if you are going to make such type of chart, by looking at the chart, by looking at the plus plus, you will come to know. आपको थोड़ा सा you will take a little bit time memorizing all this, but once you memorize it, इसको 2-3 बार पढ़ते हो, so immediately that sequence will come in your mind and you will memorize it, and by memorizing that you can write the therapeutic uses. So next one is in the same group, erythromycin. It is a semi-synthetic, mainly it is used for the CAP, community acquired pneumonia, जहाँ पे आपका erythromycin and all that, mainly it is effective against the resistant microorganism which are showing the resistance for the penicillin, for the erythromycin, okay, and for the non-tuberculosis mycobacterial infection, there also it shows the activity. In the last drug in this category is spiramycin. Spiramycin क्या है कि अभी it resembles the erythromycin, and where we are going to use as such ये कहीं पे use नहीं होती, we use it only for the toxoplasmosis, ठीक है, in and where the toxoplasmosis is the cause for the recurrent abortion in the pregnant women. So इसमें 3 का याद रखो, you have to give for 3 weeks, 3 हफ्ते आपने देने, and again 2 weeks आपने gap डालना till the delivery, and you have to give 2 to 3 times a day for the 3 weeks. And important side effect, they are related with the GIT, that is gastric irritation, nausea, diarrhea and rashes. Now coming to the important adverse effect, again I am focusing the previous slide, ठीक है. तो पहली वाली स्लाइड में जैसे मैंने इसमें आपको थेरापेटिक यूजेस एंड ऑल बताए, द सेम इन द सेम स्लाइड यू कैन राइट द adverse effect. So in the therapeutic uses, I just forgot, you can remember this therapeutic uses with the one mnemonic, that is claw. C, with the C there is a chancroid, chlamydia and campylobacter. L is legionella pneumonia, A is atypical pneumonia and atypical pneumonia, and W is for the whooping cough. Similarly for the ADR, you can remember macro. Macro is, M stands for mortalin receptor agonist. मैंने पहले I have told you all detail because of that. It is used for the gastric diabetic gastroparesis. A for the allergy, it shows the allergy, ठीक है. Allergy like rashes and allergic reaction, they are very very common. Then C for the cholestatic jaundice, especially with the acetolate. So it is acid labile. So ester entry-coated erythromycin, they are used. Erythromycin base and erythromycin ester, they are not showing any jaundice, but erythromycin estrolate, they show the cholestatic jaundice. RO stand for the reversible ototoxicity. So these are adverse effect with the erythromycin. Whereas if you take up the clarithromycin, roxithromycin and azithromycin, their safety profile, it is very good. Especially with the erythromycin, dizziness, headache, and they are very well tolerated. इसमें क्या है, GIT side effect, they are very common with this. Epigastric pain, diarrhea, that is very common, especially in the children. Whereas the GIT side effect, they are not seen with the rest of the drug. So you can see here erythromycin, its adverse effect, GIT, then mild to severe epigastric pain in children, stimulates the motiline receptor, right? So whereas rest of the drug, they do not show much. Now what else in this group of the drug is need to be discussed is its important drug interaction. Now remember one thing, the important drug interaction related with the enzyme inhibitor. So one is, you remember, एक होता ना rheumatoid arthritis, rheumatoid factor RA, इसमें क्या है, negative, whereas this shows the positive. So that means no drug interaction they are seen. So negative drug interaction, whereas इसमें क्या है, positive drug interaction. Now what type of drug interaction they are shown? Erythromycin and clarithromycin, they are enzyme inhibitor. They are enzyme inhibitor. So they are going to inhibit what? Cytochrome 3A4. So once they are going to inhibit this enzyme, if you are going to give with erythromycin, अगर आप दे देते हो terfenadine, cisapride, estamizole, if you are going to give this, because this drug, it is going to inhibit this enzyme, and all these, they need this enzyme for the metabolism. अब ये enzyme इनको मिलेगा नहीं, then what will happen? Their plasma level will increase, and this is going to increase the QT prolongation, and that is TDP, torsades d pointes. This is an important drug interaction which is shown by erythromycin and clarithromycin, but not with the roxithromycin and azithromycin. That's all about the macrolide. So if you like my video, please subscribe my channel and put up the important suggestion in the comment box.